Hi everyone, my name is Giovanna Pesci. This is my Careers in Health Information Management project. Learning about careers in healthcare will allow us to find one that best fits our interests. There are so many different paths you can go in. The careers I'll be covering today are the Director of Health Information Management and a Chief Privacy Officer. These are the two I find really intriguing and enjoyed researching and learning more about. So the job qualifications: for the Director of HIM, you do need a bachelor's degree in Health Information Management or a related field. A related field, for example, would be Healthcare Administration. You do need to complete a CAHIIM accredited degree or be enrolled in a program like we are, part of the AHIMA program. You must be certified as an RHIT or an RHIA, Registered Health Information Technician or Administrator. You do need experience. So like our PPE will have in some semesters really help us learn more about the jobs and find something that we really enjoy. You do need to have experience working with electronic health records, and you definitely need to understand HIPAA. For the Chief Privacy Officer, you do need a degree in Health Information Management. You do have to be certified in Health Privacy and Security or certified in Healthcare Privacy Compliance. Do need to have knowledge of privacy law and, again, understanding of HIPAA. Also needing work experience, again with PPE, this will really help you branch out. And you should have a legal or technology background. That'll definitely be helpful for this career. The salary: Director of HIM in New York, where I'm from, they make around $150,000 to $136,000 a year. In the US, it ranges between $70,000 to $180,000 on average. And then for the Chief Privacy Officer, the salary is looking to be $185,000 to $325,000 within New York and the US. The salary range was very similar when I was researching it. Responsibilities of both positions: daily responsibilities are looking to be pretty different. The Director of HIM oversees all of the Health Information Department. The responsibilities: they oversee release of information requests, respond to audits, check patient access, insurance verification, and eligibility. The Chief Privacy Officer oversees the facility's security and privacy. So as you can see, they're both overseeing two separate departments, two separate things. The responsibilities: they work with the general and legal counsels. Like I said before, like privacy law is definitely important for this position. They ensure that policies and procedures are being integrated and addressed in this facility. They are a leader. They oversee consumer information and access rights. Now the job outlook. Both jobs are ranked very high according to 100 best jobs according to the US. For the Director of HIM, we can see that in the past 10 years, the health information management field has significantly grown. There are so many new jobs now due to new technology and systems. For example, AI. We're seeing a lot of new AI be implemented into healthcare systems. For example, in the medical field, there's more AI. We're seeing more robots doing surgeries, which is super cool. Medical and health service managers are ranked number 6 in the 100 best jobs according to the U.S. News. There's a lot of technical growth, allowing for future growth and more jobs. The Chief Privacy Officer job outlook has quickly become a very important role. The outlook for this position is very favorable. The employment rate is expected to grow around 32% over the next 10 years. This 10-year period started in 2022, so it already has grown significantly in the past 2 years, and we'll see where the next 8 years take us. My strengths and weaknesses. My strengths are that I'm a very quick learner. I love learning. I am very tech savvy. I do have some leader capabilities. I find myself to work on things without being asked. I'm very good at continuing to work. I don't just sit around and wait to be assigned something. I'm very creative. I always have good ideas. I have quite the imagination, and I am headstrong as well. If there is something I'm not doing right, tell me so I can fix it, and then we can all be happy and successful. My weaknesses, the only weakness I came up with was being introverted. I do find myself to be pretty shy, but I have been branching out and feel like growing out of that a little bit. Being a leader is a part of both positions. You have to be able to motivate your staff. The strengths that I have, I believe, to align well with being successful in the position. I want to be a good leader. There are still so many things to learn about healthcare, and I find that so intriguing. I can't wait to learn about the new AI that they're implementing and learning and seeing how the new systems are going to help change healthcare in a positive way. I did interview Jamie Pesci. She's the Vice President of Revenue Cycle and the Privacy Officer at Christian Health in Wyckoff, New Jersey. She was the Director of HIM and has been promoted to VP of Revenue Cycle and Privacy and Security. Her first healthcare job was a chart analyst. She collected charts from discharged patients and completed them for release and permanent filing. As Director of HIM, her day consisted of going through discharges, admissions, accounts that are discharged and haven't been filed yet, and also extended stays. As privacy officer now, she has learned more about privacy and security and how it's key to creating an environment that's protected so that you can be billed and reimbursed on the regular with no issues. Her biggest tip was to know your staff. Being a leader and having people skills is really important. She also stated that you are only as successful as the team you're working for. I am confident that I will be able to motivate the people I have working for me or I'm working with so that we have a good team and a good success rate. My reflection. Now, both of these careers have very high success rate and job outlooks. I would be happy with either position. I do find Chief Privacy Officer a little more interesting. Obviously, it's not a job you can just jump right into. It's definitely one you have to grow to. I am hoping to work up to it in my career. I'd love to not start off like it's my first job, but to grow and learn to be a director of HIM and then work my way up to Chief Privacy Officer It's definitely going to take years of experience to get to that point, but I'm feeling confident and inspired. Jamie was able to inspire me quite a bit about this career path I've chosen, and I can't wait to see where it takes me in the future. Thank you. That's all.